We're just getting to the stage where you can 80/20 a gene therapy for most uses and it will just work, which is a big difference from the last 20 years where it was really, really hard to build these things. And it was massive amounts of effort to get the last 5% out of your gene therapy, and really people could only target the liver because that's where everything goes anyway, and so on and so forth. But we're moving beyond that, and if anybody has a great idea about how to edit genes or how to provoke more protein expression of a certain sort, then the actual cost of doing it is very low. The cost of development is all regulation and getting it safe and getting it reliable. But anything I do in my company, which is largely protein upregulation, for $50,000, somebody could just go out there and kit bash their own thing. Not saying it's a great idea to do this, but you could. It's technically possible. And we're going to see this happen in the years ahead, where people can go out there and run their own gene therapies. It's actually not that hard in the grand scheme of things. It's not that smart either, but it's not that hard. It's a very interesting state of the market right now. It's just at that point where the ivory tower is dissolving, and the fact that you could only do it in a business is dissolving, and the technology will become available to a much wider range of people. I mean, from a point of view of actually doing it, completely setting aside questions of safety and sanity, you could do it now. You could set up a fake company front and you could go and order a bunch of AAV for a specific gene. You could inject it into yourself in Mexico. This would be a really dumb thing to do, not to mention probably illegal on several fronts in several places. But the fact that it is possible and for such a low cost means that at some point we have to think about, what really can you do that's practicable and safe? And there are several gene targets that are, about as safe as anyone can make them. So, for example, myostatin and follistatin for regulation of muscle growth. You can go in there and upregulate your follistatin pretty easily in the grand scheme of things, if you wanted to. And the question is, is that a smart thing to do right now? I mean, so far, everything bar one that I can think of suggests this is perfectly safe. We have all sorts of mutant myostatin and follistatin examples in mammalian species, including humans, natural mutants. So, the question would be, why not? Why are we not doing this? Why are we sitting there and saying, well, we have to go through this enormous trial and only the anointed priests of biotechnology are allowed to do that? And that's kind of the way we've settled on things in our present society. But is that the only way to run things? Probably not. So there's definitely a tension as soon as prices drop low enough that people other than the anointed priesthood can start to do things. And that tension will be out there and being explored over the next 5 to 10 years. It will be quite interesting to see how it goes.